Southern Maryland's morning show. T-Bone and Heather.
That is us. Good morning, everybody. We're going to jump in here because we got the doctor on the line with us, Dr. Howard Haft. Good morning, sir. How are you?
Good morning. I'm fine. How are you today?
We're doing well. Thank you for being part of the show this morning. We appreciate you calling in. I know you're very, very busy with a lot of stuff going on. But we did want to touch base with somebody from the health field in Charles County because recently Charles County kind of went a different direction from, say, Calvert and St. Mary's County. And that caused some folks to be a little agitated. So we thought we would check in with you this morning and see why that decision was made and overall how are things going in Charles County.
Yeah, how is the health in Charles County, Dr. Haft?
So I think Charles County's health is generally good. If your concern is specifically about COVID-19, I think that Charles County is doing as well as can be expected in this very unprecedented pandemic, far better than many of our neighbors in many ways, and I think it's been because of the interventions that have been done across the state by the governor, and also because of the things that have happened within the county. People paying attention to the good advice of sheltering at home for a long period of time, good hand hygiene, protecting one another from spreading the virus. So we've done, I think, as well as we can under the circumstances that exist.
Do you think the Charles County Commissioners made a good choice when they decided to wait a couple of weeks before instituting stage one of the governor's edict getting people back to work? Or do you think maybe that Charles County would have been ready to open businesses and get stuff started on Friday?
That's a very difficult question to answer.
Mm-hmm.
There is no clear demarcation line that says you've crossed over a line and now you're safe to open up, safe to resume normal activities, because the virus is still around in the community. So these are all risk-reward decisions, and there's no right or wrong in those decisions. It's a decision that's I guess best deliberated by leadership in terms of the direction that we go in, because there is no clear correct answer or an incorrect answer. We do know that since the virus is still around, and it will be until such time as we have a vaccine or a credible treatment for it, that we all need to be very cautious because it can continue to spread. And the notion here is with phased recovery is that we'll incrementally do things that are safe, relatively safe, and continue to build on those successes if there are successes and there's no new spread of the virus until we get back to some state of normality, and all of this leading toward a time when we can eradicate the virus either through a medication or an immunization. But just for instance, so when we say we open up, it doesn't mean that suddenly the door slams wide open and then everybody can do everything. It means that businesses, personal services, manufacturing need to now implement safety precautions that they probably had never done before, in terms of social distancing, in terms of face coverings, in terms of a whole list of other things, and these are things that businesses and industry and religious organizations and personal service organizations and marinas and golf courses all need to prepare for. They need to prepare staff. They need to prepare their facilities. They need to let the public know about how this is going to change the way we do business.
Well, let me ask you this, Dr. Haft, because you said there's no clear demarcation line, but the consistent factor for as it relates to this pandemic, not only locally but nationwide, has been numbers. We've been looking at numbers, and they say when you reach this number, we're going to do that. And when we reach that number, this many days, we're going to do this. So numbers are vital. They may be fluid from the perspective of how the county perceives them, but they are vital moving forward. So what is the number? What are we looking for from Charles County to say, okay, we're going to do what the other kids are doing, and we're going to join Calvert and St. Mary's County?
Yeah, no, that's a good question. I think we do want to go through this pandemic being led by science and data to the greatest extent that we can. So science is not perfect and the data is fluid, as you just pointed out. The indicators that the governor has used, which shows great wisdom, I point out, is in terms of the beginning of phase one recovery, was that we had indicators that we had sufficient capacity in our hospital system should phase one have a failure, and there was a sudden surge of new cases, and we would not overwhelm the hospitals.
And do you feel right now that if that was to take place, the hospitals would be overwhelmed?
So the governor and the state has, and together with the hospital system, has undertaken over the last 2 months to build what we call surge capacity. So we've nearly doubled the number of potential beds in the hospitals, even while limiting the current capacity of the hospitals by saying there's no elective procedures. So at a point over the last 2 weeks, we've had sufficient capacity in the hospital system, including in Charles County, should there be a surge. But this does not mean the same thing as that we're safe overall. This virus is still around. It only means that we're safe so that if there was a sudden reoccurrence, that we would have hospital capacity. That's all that says. It shouldn't be interpreted as saying we've beat this in any way.
Right.
It just means that if we have a failure and people don't behave and they go out in larger groups and the virus spreads and vulnerable people get affected, that we still have a way of taking care of them. We wouldn't have the kind of catastrophes that we're seeing in Italy or in early in China or in New York City or other places. So we wanted to at least make sure of that. Now it's all about being able to gradually do the right things as we change the way we deliver business and as we continue to tell people to be very safe, because this virus is not gone. We still need to, do the face coverings. We still need to not congregate in groups greater than 10. And we're going to do what's called contact tracing now going forward, which was as soon as we identify an individual who is positive for COVID-19, we will have contact tracers who will ask them, who did you come in contact with, and get in touch with those people and test those people. So to do the kind of the standard way that we contain epidemics. We couldn't have done that before because we didn't have enough testing, we didn't have enough contact tracers, and it would have been an overwhelming situation. But we've tamped it down now good enough because of the mitigation that we can now start this kind of process.
Hey, doctor, let me ask you this. As of this morning, how many deaths from COVID-19 are reported in Charles County? I'm sorry, did I put you on the spot there? I'm sorry.
Yeah, I believe you did. I think it's in the. I don't want to give you. It's in the range of 70 total.
Okay.
Now, how many of those people, because, it was in the news, crazy in the news about Sage Point, okay, with and the way that they were conducting business there. How many of those people are on the list of the deaths in Charles County? That one group. I put you on the spot again, didn't I?
So I don't have the number for one group. I
Okay.
do know that for the deaths in Charles County, the vast majority of them have been in our skilled nursing facilities.
Right.
And assisted
So
living
if you took that number out of the equation and said, "Oh, well, we can see that as an anomaly because it is," and if you took that number out of the equation, wouldn't you then be ready to move with the other two counties?
So that's not an indicator that we use. I think it's the indicators. The movement is really based on
Cases.
That we know that the virus is still around. It's based on our comfort level, the risk versus the rewards in terms of the risk to the health versus the rewards in terms of being able to open up businesses. And I think I don't have an answer for that.
Yeah.
Whether
Well,
it's
nobody does.
a
Right.
week or 2 weeks. Yeah, whether it's a week or 2 weeks, or whether whether we could certainly save more lives if we sheltered in place until we had a vaccine, but that's not. Then we run it up against what are the economic and
Right.
other consequences of those things. So that I wish I could say, boy, there's great wisdom in going one way or the other.
Right.
But there isn't.
Well, Dr. Haft, I appreciate your time this morning. Thanks for checking in with us.
Right.
And feel free to call anytime.
Absolutely. We'd love to
there's
hear from you.
Anything happening on your front that you want to share with the folks of Southern Maryland, we would be a great resource for that. So please make use of it.
Yeah, I just would point out we at the Department of Health are building a strong coalition of business and industry leaders, and we'll be meeting on a regular basis and beginning this week to make sure that we are well prepared to serve the citizens of Charles County and Southern Maryland in the safest way that we can. We will get helping each other. We'll get through this together.
All right. Thank you for your time, sir.
Thank you, Doctor. Appreciate it.
18 minutes after 8 o'clock, 8:18. Phone lines are open for you. That was Dr. Haft, Howard Haft.
Right, spokesperson for Charles County Health Department. We appreciate him on. It's just a bear, these decisions
It's a tough
that
call.
people are making, and he's right. What do you do? Do you open up? Do you wait for a couple more weeks? It's very hard to say.
It's a tough call, and listen. It's easy for me to sit here and say, "Well, you should have done this."
Right, right.
Well, yeah, okay, yeah. But I do think that if I had my druthers, I would have preferred Charles County to be on track with what Calvert and St. Mary's County is doing. If for nothing else, that you have some type of continuity between the three counties and a consistency in the way the individuals who live in the counties, it doesn't matter whether you live in Calvert County or St. Mary's County, you're probably traveling through Charles County, or you work in Charles County, you live
Right.
over here. These three counties are intrinsically linked together, and everybody's lives are linked together. It would have been nice if we were all on the same page. And I think, in fairness, if you took that one home out of the equation, the assisted living home, I think you'd see a very different number.
But I don't want it to. When I asked that question, I was just curious. I don't want anybody to think that the lives lost in nursing homes are any less than anybody else who
No, I'm not
catches
saying-
it.
nobody's
But-
saying that.
But it is a confined space.
But here's
It
the
is-
thing.
Do you know what I mean?
Yes,
because
it's
it's
a-
still tragic, no matter where
Look,
it happens.
Here's a scenario. Okay, here's an analogy. Not a scenario, an analogy. Let's say you were tracking automobile deaths. All right? And let's say there was a county somewhere, and they had 20 automobile deaths for the entire year. Okay? But all 20 of them came from one accident. Would you then change the way you look at roads and speed limits and so on and so forth based on the fact that you had 20 deaths? Or would you say, well, if you take that one accident out of the equation, we didn't have any?
Right.
So to say that there's this number and a big portion of the I don't know what the percentage is.
But I liked what the doctor said too, that the governor, it's more about the beds. It's more about
understand.
hospital
Sure.
and capacity. And
Again,
if there is a surge, are we going to be behind the eight
Yes.
ball, or are we prepared?
I'm not saying what they're doing is wrong. I'm not saying that they are doing something wrong here. What I'm saying is, if we're looking at numbers, and all of this is number driven, right? Fauci comes out there with his little glasses and he stands there and he tells, we got to do the science. Okay, science is numbers. If you're going to look at numbers, then look at numbers fairly. And if there's this one little pocket where some bad stuff happened, through no fault of anybody, I'm not saying that there was negligence. I'm just saying that if this one place had a big number, okay, yeah, we recognize that anomaly. Let's take that out of the equation and now look at the county as a whole.
Right.
Then it's a different scenario.
Huh.
Hi, good morning. You're on with T-Bone and Heather.
Good morning, guys. How are you all doing?
Good morning.
You were talking about Dr. Whitten a while ago.
Yes.
Right now, he's not seeing patients. I called about my father for my cataract surgery, and the lady said that well, I heard he's going back to doing some cataract surgery, but not much. But the girl said that people will be getting a call for that. And also, don't know what's going to go on with the church right now either, because I got another message from my music director. He doesn't know what's going to go on with the choir just yet.
No church,
because
huh?
The 6 feet thing, and they'll be getting back together anytime soon.
Oh, no, that's not good news. All right. Good luck to you.
All right, it is 8:22. Our phone lines are open for you. If you want to give us a call this morning, you certainly can, and we enjoy those calls. We'll field as many as we can. 1-800-STAR-983, 1-800-782-7983 if you happen to be listening on STAR. And if you're listening on 97.7 The Bay, it's 301-884-4615. Yep, either one will get it done, and we'd like to chat with you, so feel free, call in, and we will discuss whatever's on your mind. 8:22, let's see what's happening with the weather out there.